Hi, I am Dr. Felice Gersh, your integrative OBGYN doctor, speaking to you today on a very important topic, the COVID vaccines. There have been many myths that have been circulated all over this country concerning the messenger RNA vaccines. And that's what I'm going to focus on because the J&J version of the vaccine is really out of the circulation right now. So we're left with the Pfizer product and Moderna. So let's talk about the myths. I go to my office every day and I hear these. So I'm going to tell you about the ones I hear the most. Probably the most common one, which I heard twice today, was I do not want to have one of those vaccines because they're experimental and dangerous. So let's talk first about the concept of it being experimental. Vaccines take years, and this was just, it seemed like you blink an eye and there it was, ready to go. Well, it turns out that the technology and research surrounding messenger RNA vaccines have been around for a couple of decades. And in fact, I really wanted to vet this whole process out myself. So I went to PubMed, that's the government website where they archive all the published articles that are peer-reviewed throughout the world. Things have been published. And I basically read every one of the articles that had been published over the last 20 years involving messenger RNA technology. So I learned and could easily see the evolution of the use of this technology, which is absolutely brilliant. It turns out that, yes, research has really been around for 20 years. But then you could say, but how could this come out so fast? Well, it was a very concerted effort. Believe it or not, part of the benefit and the enabling of this to be done so quickly came from China, because the Chinese gave the genetic code out. They actually analyzed the very initial one of the COVID variants, the first one that came out, the alpha, and the original, I guess they call it the wild type. So that particular type of coronavirus, the SARS-CoV-2, was assayed genetically, and the genetic code was given out by China to us. And that enabled them to really rapidly develop this amazing tool. Now, what else? Well, because the virus was so prevalent, the infection rate was so high, when they recruited, and that, let me touch on that, they were able to recruit volunteers for these studies incredibly rapidly through social media and just word of mouth. They were able to get thousands, over 40,000 people into a study. I'm going to speak about the Pfizer study, but the Moderna study also was very quick. The first one out was the Pfizer. So they were able to recruit study subjects, the volunteers, incredibly rapidly. Normally, recruitment for any pharmaceutical study is a very laborious process and can take a long time because not everyone wants to volunteer. Well, in this case, many thousands of people stepped up to the plate. You may think, wow, that's really amazing, and I wouldn't do it. Well, these people did. They did volunteer. So they had thousands right out the gate willing to volunteer. And then because the infection was so rampant, they were able to retrieve the differential in terms of infection rates and outcomes between those in the study that got the placebo, which means they didn't really get the real vaccine, and those who got the vaccine. Isn't that amazing? They had rapid recruitment, thousands of people, and then they were able to show in a much shorter time than would ever be normal with any kind of a vaccine study, the difference in prevalence and outcome between the two study groups, those treated with the real vaccine and those who got the placebo. So, because they had all this data and it came out so rapidly, the technology was there, China gave us the genetic code, and they started to produce the vaccines just on, you might say, on spec, before it was even authorized under the emergency use authorization. So everything was geared up to make this happen rapidly. It really seemed like, no, this is not feasible. Well, yes, it is and was incredibly feasible, and it happened. I mean, if you go back to the space race, we caught up to the Russians really quickly, because when there's a will, when there's investment, there's a way. So it was not done cutting any corners. All of the data was achieved, all of the safety endpoints, everything was done properly. There were no shortcuts, no deviance from normal processes. What was different was the amazing rapidity that this process was able to achieve for all the reasons that I just said. Now, every pharmaceutical that is released has to go through a post-release sort of time when it has to be studied. And that's true of every pharmaceutical. And this really is under the umbrella of pharmaceuticals. So after it's released, you have to continue to collect data, the real world data, because every pharmaceutical, any drug you've ever heard of, when they did the original study to get FDA approval, I can absolutely assure you that it was not a completely randomized, generalized, universal inclusion across the entire population and all types of people in the country. It is never that. They always have exclusion criteria. Like when you have a drug study, they say, well, we can't include this other drug, or they can't be on this, they can't be this age, they can't have the other conditions. And this was true too. So yes, it is true that not every population was studied in the original study. Just like with any other pharmaceutical, it's a very select population. Then you have real world data collection. So now you know it wasn't done too rapidly. It wasn't like some kind of weird experimental type of premise. The data was collected in a very appropriate way. No shortcuts were taken, and all the steps were done very properly. And we could do it because we knew what we were doing, because we had the experiential and research science all there from the previous 20 years. The next thing was, it's really dangerous. We know that there were very few serious adverse events in the study population. But once again, that is a selective population. What happens in the real world? Well, we did learn some things. Every drug, every pharmaceutical, have you ever watched television? They all have an array of side effects. And this is under that umbrella, and there are some. When you get the shots, yes, they do have sometimes fever, feeling flu-like, back aches, arm aches, general aches, and so on. Those are very short-lived. Those are not dangerous. What about something that's really dangerous? Well, the one with the blood clots, with the J&J, affected a tiny percentage of younger women, and that was real. It was very rare, but it was very real for that tiny number of people affected. And it really ended up creating warnings in many countries. They said, if you're in this age group, this population, we don't want you to take it. And it really has phased out. But in reality, that was a tiny percentage. The risk was really, really low. You can't say zero. There is nothing that you do on this planet, whether you drive a car, go skiing, take an aspirin, take an antibiotic, none of those things are risk-free. And in fact, I looked it up, over 3,000 people die every year in the U.S. from just taking aspirin appropriately. And we won't go into all the other risks of every other drug. But I can tell you this risk was minute, but it was not hidden. It was out in the open. And the J&J has really fallen into disuse now. But almost very, very few people. That's not to discount the people who were affected, of course. So that's real, but it's very rare. Now, what about the messenger RNA vaccines, the ones that are still widely used? Well, in terms of side effects, there is the myocarditis. Now, the risk of myocarditis is also real. It is also rare. They have now done a lot of research and found that the risk is 1 in 1 million doses of the vaccine. So 1 in a million. What about from the actual infection? The risk with the infection is 6 in 1 million. So 1 in a million is from the vaccine. 6 times that number, 6 in a million, is from the actual infection. So the bottom line is you have 6 times the risk of getting myocarditis from an actual infection. That said, it's still 6 per million from the actual infection. Now you know about that part. Now let's talk about some of the other things that have been premised. What about affecting fertility? Well, it turns out that we now have actual published data that it does not affect fertility. And realistically, the data never even suggested that it would. This was a wild hypothesis based on the fact that there's a type of a spike protein that's present on a protein in the placenta that was thought to be somewhat similar to the protein that is the spike protein of the coronavirus. Well, they're really very different. And in fact, remember, there are only so many amino acids. There's going to be some similarities on a few amino acids in every single protein. But this was wild, and it doesn't happen. And if it did, it would happen more with the actual infection, where your body is going to make a much more prolonged production of antibodies against the spike protein, which would then cross over against this protein on the placenta. The bottom line is it doesn't happen. That is not true. So this is a takeaway. Please, getting these messenger RNA vaccines do not affect fertility. Now, what about pregnancy? Is it dangerous in pregnancy? Well, I am very cautious about everything that has to do with pregnancy. And I was very cautious at the beginning. I would be totally truthful. It's like, wait a minute, we just don't know. Well, fortunately now we do have data. So the data shows, and this is what I predicted, that it would not cause miscarriages or any other adverse event during the pregnancy. And it's actually beneficial if women get it when they're pregnant because the antibodies can go to the little baby and actually help protect the baby. And as well, if you're breastfeeding, it can also help through the breast milk. What about the idea of if you've had the vaccine, then you don't need to get the booster? Or like the first 2 doses, because now Omicron is so mild and weak. Well, the bottom line is that if you've had 2 doses of the Pfizer vaccine, and now you're out all these different months because it's been quite a while, your chances of being benefited have dramatically reduced. That's the reality. So that your chances of going into the hospital are reduced, but not anywhere near the way it would be if you got the booster. In fact, if you got the booster compared to not having it, your chances are dramatically improved. Like 80% chance that you will not end up in a hospital as a hospitalized patient, whereas the risk is much lower, like around a 50% chance that you'll be reduced. Now, that doesn't mean you have a 50% chance. We're talking about percentages. So you are 80% better off if you get the booster versus only 50% better off if you get 2 shots and you don't get the booster compared to not getting any shots at all. So it is better to get the booster, even with this somewhat milder form, because there are still people who've had 2 shots and they end up in the emergency room or they end up very ill. It's not a high percentage, but why even take a chance? Why not just get the booster and then be better off for it? There are so many different myths out there. I wanted to cover some of the really key ones, that this was produced rapidly, that it's not safe, that they cut corners, that it's experimental. No, this has never been done. We don't have the data. That is not true. We have millions, hundreds of millions of people have been vaccinated. So we have collected enormous amounts of data, more than probably any other drug that has ever been created has had this much data in such a short order. So it doesn't affect fertility. It won't affect pregnancy. And if you've had 2 doses of one of the messenger RNA vaccine, You have much more benefit if you get another dose. And just as a last couple of words, if you have had the infection and then you get the vaccine, you'll have twice the benefit, okay? You will dramatically have benefit if you get it all. That's not to say that just having the infection isn't beneficial, but we don't know how long it lasts. If you do that, plus you get the vaccine, you're in much better shape. So this is safe, this is efficacious, this is science at its best. And nothing is perfect. So I hope that helped, and I hope you all stay safe. See you soon. Have a good day.